You're watching NCTV, celebrating 20 years of community broadcasting.
Welcome. Thank you for coming to the Measure S Town Hall Forum at the Nevada Theater. I appreciate your interest in coming out this evening to learn more about this measure. I don't know if you guys probably read a little bit about this. It's been a bit of a challenge to provide an opportunity for folks in the community to learn more about this measure and be able to gain the information necessary to vote responsibly. My name is Jim Hemig. I'm the publisher at the Union newspaper and theunion.com. Why am I here? At this point, I'm kind of confused myself after driving around. So if you've read any of the press releases, if you've read the newspaper, I felt it was my responsibility, and of course the responsibility of the newspaper, to try to provide as much information moving into the November 4th election, as much information as we possibly could on Measure S. Again, as I said, really trying to provide an opportunity to understand so you can make a good voter decision. We initially had some thoughts about putting on a debate, and Paul Emery, I think he's floating around here. We engaged in many emails back and forth, trying to put on a debate, and we couldn't seem to get both sides in an agreement on the location. So we ended up trying something different. So my muscle here, Carrie Brenner, she is helping me tonight. We ended up with a list of questions from the Union readers, and we went over to the Rood Center before we came here tonight, and we had a list of questions, and we were able to ask Sheriff Keith Royal and County Counsel Allison Barrett Green. We had Ed Schofield. We also had Lieutenant Bill Smithers, and Don Bessie was there. So we were able to ask those folks the same questions that we intend to ask tonight. So the format might have broken up a little bit in terms of a face-to-face debate, but my goal is still the same. I wanted to be able to provide as much information to our county here as possible so we can make an informed voter decision. So why are we here? What are we talking about? Specifically, Measure S is a proposed revision to the current medicinal marijuana cultivation ordinance. So Measure S modifies the ordinance and makes adjustments to the parameters to grow medicinal marijuana. So there's quite a few specifics along with that, and I'll have a chance to ask some of those questions. So in terms of a kind of a town hall forum structure, what we'll have tonight is I will be asking the questions from the Union readers to our panel here, and then I'm going to be able to open it up to the floor to let the folks here ask questions that you might have, and the panel will answer those. So we'll have a little bit of Q&A from me. We'll be able to open it up to the floor. All of this will be recorded. Carrie's recording this, and she'll be able to write a story in the Union newspaper that compares the answers from our earlier Q&A with the folks over at the Board of Supervisors chambers, and then of course tonight here at the Nevada Theater we'll be able to take the same questions and have answers to both. This is all part of a series of stories we've been running and will continue to run up until the election about Measure S, so we can provide all these different viewpoints. NCTV is also recording this. They're having it on TV live tonight, and they'll also be able to replay that. So in terms of getting the information out, I feel like we're really doing our best to do that, even though some of the discussion about the debate has changed. We're still trying to provide fair and balanced information about what's going on. So before we move into the Q&A, I'd like to introduce our panelists and ask them to kind of give a little introduction of themselves and maybe why they're here. But I'm going to ask them to keep it to a few minutes because we want to leave time for questions. So maybe we start on the far end. Doctor, would you like to provide an introduction?
Sure. Yep, if you can hear me okay. I'm Dr. Sean Devlin. I work for Highland Springs Wellness Center. And
Closer to
oh, you guys okay? All right, louder. Hello? Okay. Again, I'm Dr. Sean Devlin from Highland Springs Wellness Center. Okay, can you hear me now? All right, so I'm gonna have to be right on top of this thing. You know, I'm a local physician. My name's Sean Devlin. I've worked here for about the past decade doing integrated pain management and integrative medicine, and part of my practice is to make recommendations for patients so that they can access and utilize medicinal cannabis. As you know, back in '96, through Proposition 215, state of California and the citizens thereof decided that it was necessary to pass a law to protect those who were using it at the time sort of under the radar and illegally. And since that point in time, many counties and cities have made augmentations or developed their own rules in and around how patients would access and or generate their own medicine. In some cases, some patients are limited by having no access to dispensaries. In other cases, patients are just limited as to what they can grow. Unfortunately, with the changing paradigm, politically and scientifically speaking, we have a lot of new information coming out about cannabis and its use. And unfortunately, no specific shoe size fits every patient. And you're dealing with patients in some cases who may use up to pounds of marijuana a week versus patients who may use micrograms of cannabis a week to treat their ailments. And so in order to allow for patients to have appropriate access and safe access, I thought it was necessary to represent my opinions, medically speaking, on supporting Measure S for the mere fact it's a clearer law, in my opinion. And number two, it allows my patients to do what they need to do to access their medicine safely without any fear or repercussions from the law. And that's kind of my stance on things. So thank you guys for having me here.
Thank you, Dr. Patricia.
Hi, my name is Patricia Smith. I'm the Nevada County Chair of Americans for Safe Access. I'm also the host of Cannabis Crusades on KVMR. And I'm here representing patients because in all the discussion about the pros and cons of Measure S, it seems to me that patients are the ones that are being overlooked. That can't be. This is all about patients. It's not about the illegal commercial growers that are in this county. There's plenty of laws right now that deal with those issues. I have been an advocate for patients since the 1980s. I used to be a costume designer in Hollywood, and I worked with a lot of people that developed AIDS in the 1980s. And it was devastating. We didn't even know what the disease was at the time, but I'd go away to do a movie and I'd come back and people that I had known and loved looked like walking death. And it was one of the worst times of my life. And all I could think of is, how can I help these people? And I knew that the loss of appetite was one of the worst issues they were dealing with. So in my feeble little brain, I made them brownies laced with marijuana, thinking it would stimulate their appetites. And I was so shocked to hear all of the wonderful reports I got back. And they would tell me, like, oh my God, it's the first time I was able to sleep through the night in months, or I was able to hold down my medication without violently throwing it up so it could maybe actually do me some good. And it controlled my pain. It was just groundbreaking information. I had no idea at the time, but it certainly opened my eyes, and I've become a true believer, and I have championed patient rights ever since then, and I will to my dying day. So thank you.
Thanks, Patricia. Steve?
Thanks. My name is Steve Munkelt. I'm an attorney. I've been practicing in California since 1978 and in Nevada County primarily since 1987. I'm a certified specialist in criminal law with the State Bar and have practiced primarily criminal law through most of my career. One of the aspects of criminal law, as you all know, is marijuana as part of our drug control efforts at the federal and state level. And I'm going to give just a couple of minutes of sort of an outline of the legal structure, which I think might have some bearing on the answers to other questions tonight, just so there's a context to reflect the answers against. First thing is, as you all know, under federal drug laws, any cultivation or use of marijuana is illegal. And there are no exceptions. It's just flat illegal. Under California state law, any cultivation or use of marijuana is illegal. It's flat illegal. But starting with Proposition 215 and then expanding with the SB 420 Act in 2003, California has made exceptions. So quite different from the federal law that way. And that difference has been upheld in the courts. The courts have said it's okay for us as a state to be different than the federal law on this issue. I also want to just mention in passing, because I think it's a very important part of this particular issue on a county nuisance ordinance, that under the state constitution, Article 1, Section 1, so the very beginning of the state constitution describes what inalienable rights the citizens of California have. And that includes, as you might guess, the right to enjoy life and liberty and acquiring, possessing, and protecting property. An awful lot of Americans and Californians that I've run across feel very strongly about their property rights. And I think that's really a key to looking at this issue about the ordinance, because at its bottom, at its real base meaning, an ordinance to regulate nuisances is a land use ordinance. It's not a way to regulate criminal behavior. It's not a situation where law enforcement should be involved. It's a land use issue. How do I, as a patient who has a medical authorization that exempts me from the criminal requirements of California law, how do I cultivate marijuana, a process that's promoted by the statement of purpose of Proposition 215 and SB 420. So it's a land use issue. It should not be adversarial. It should be cooperative. When the county deals with other land use issues, their primary goal is to get people into compliance, whether it's building codes or water use or any other land use issue that's regulated by the county. The goal is to get people into compliance.
Thanks, Steve. I know I said this a few minutes ago, but I just wanted to make sure that I was really clear. I can't appreciate enough how much the folks over at the Rood Center, Sheriff Keith Royal, as I mentioned, Ed Schofield was there, Allison Barrett Green, Lieutenant Bill Smithers, and Don Bessie. Carrie and I were over there. They were very polite, welcoming, answered all of our questions. We felt quite at home there. And I think at the core of that, their interest is not much different than everybody I've talked to. People here just want to do the right thing. They want to help make our county the best it can possibly be. Patricia Smith extended the same invitation to me to be here to help moderate this, and she was very nice, very welcoming, down to even ask me what kind of water I would like, still or sparkling. And through all the different discussion, the different points of view, what I'm really finding is people at a core here are very kind, polite, and again, just want to do the right thing. So I appreciate the warm welcome. So as I mentioned, these questions came from union readers, and so I think they're pretty fair questions that either side can answer. So I'd like to encourage you to take a look at the answers this week. I think we're going to try to have a story in our Friday paper that pulls all this together, but it'll give you a chance to balance the questions that we received earlier with these ones. But since this is really not much of a debate structure per se. This is really more of a panel, more of an open discussion. I'll read the questions, and then if one of our panelists has an answer, they can speak up, or if multiple panelists, we'll kind of keep this informal, if that's okay.
That's good.
And then what I'll ask of the crowd here is please be patient, be courteous. We're here to listen to the panelists, to find out their information, their points of view. So if you could, please just respect that. And then when we get to the point where we can have some questions from the crowd, I would just ask you to be respectful to one another as well. So my first question from the readers again, how many new grow sites would be possible? So how many new grow sites would be possible if Measure S passed? And where do you think these grow sites would be located?
Well, I will take that one. I don't know that any new grow sites would be possible under Measure S, and in fact, there'll be fewer grow sites, because if you live in the city of Grass Valley, Truckee, Nevada City, Lake of the Pines, Lake Wildwood, and most of Alta Sierra, you are not allowed to grow outdoor under Measure S or the county ordinance. So our whole goal is to move the grow sites to the larger ag parcels so that they will not impact neighbors in the residential areas. So I don't quite understand that question, to tell you the truth.
Mm-hmm.
And I'll pitch in a little bit with that. The county ordinance 2349 that exists presently lumps together some residential properties with some properties that are not truly residential. They're more agricultural based. And it restricts the amount of cultivation that can be done on those properties based on the theory that there may be something offensive to the neighbors about cultivation on these properties. What Measure S would do is limit those types of restrictions to the properties specifically zoned residential. So if you're an R1, R2, or R3, where the primary purpose for that property is residential, the cultivation is going to be limited, even more than it is under 2349. But in contrast to the current ordinance, Measure S will allow people on larger parcels, and all of those designated as agricultural, residential agricultural, and other uses would have the opportunity to grow their marijuana by an amount measured by the number of plants instead of by the square footage it takes to have the garden. So it doesn't appear to me that there's likely to be more parcels in residential areas where neighbors are close together under Measure S. In fact, there will probably be fewer outdoor grows in the residential neighborhoods. But there may be some additional plant numbers on larger properties where there's less contact with neighbors and less potential for any nuisance or effect on the neighborhood.
Thanks, Steve. And that kind of blends into the second question. Specifically, how much more medicinal marijuana would be grown if Measure S passes?
I would hope all marijuana that is grown in this county would be medical, but we all know that's not the case. All we're trying to do, though, is carve out a niche so that the people that are trying to follow the rules have the opportunity to do so. Right now, you cannot follow and be in compliance with Ordinance 2349 because it's riddled with poison pills that make everybody out of compliance for one reason or another. We hope that by establishing some fair and sensible rules, that it will encourage more growers to come over to the medicinal side and do the right thing.
The next question was how much of the legal medicinal marijuana ends up sold illegally?
Well, nobody knows the answer to that question.
Not even Sheriff Royal.
Yeah. And these questions are really inappropriate to the subject of the ordinance, because this is about how do the individuals use their own property. It's not about how does the community view the activity that they engage in on their own property. if people who claim to be growing medicinally divert some of their crop into illegal avenues, that's an appropriate subject for law enforcement to look into, and those are appropriate people to be charged under the current state law. But that's criminal investigation and prosecution. It has nothing to do, it's an entirely separate subject matter, or should be, from 2349 and Measure S, which should be focused on cooperatively getting the owners or occupiers of property who are cultivating for medicinal purposes into a good neighbor status of their cultivation.
I get this feeling you've read my questions before. Yeah, because that does flow well into the next one. So in your opinion, how will Measure S impact current law enforcement efforts?
Do you want to take that, Steve?
Sure. Seeing how the Sheriff's Department enforces the ordinance currently, it is very clear that they are using their law enforcement training and law enforcement approach to this issue, and that they are attempting to reduce the number of marijuana plants being grown in the county, which is an appropriate purpose if they're being grown illegally, but it's not an appropriate purpose if you're talking about people who are trying to comply with the law, both state law and local ordinance. And you know, what you end up with is this sheriff enforcing a land use issue in an adversarial environment instead of a cooperative environment. And what Measure S would do is take the sheriff out of the picture and put this into a position where people can actually work to comply with the ordinance. And if there's a problem, they'll be allowed to comply. Under the current hearing procedure that the county has established for appeals when a person is given a violation notice under the current ordinance, again, it's a very adversarial process they have set up. In my opinion, several aspects of it are actually illegal and in violation of the civil rights of the people who are appealing. And one of the ways that's true is that the hearing officer announces at the beginning of the hearing, they will not consider any evidence about the person's efforts to comply with the ordinance after they receive the violation notice. They're treating it like a criminal violation that occurred on the date of the notice, rather than treating it like a land use issue where we want everybody to cooperate here and get into compliance with the law. So Measure S would stop that process.
I'd like to also add that our hope is that once we establish a niche for the legal medical marijuana providers, that it will free up law enforcement so that they can actually tackle some of the more pressing issues in this county, like heroin and meth dealers and alcoholism and robberies, things that are a better use of law enforcement resources.
Thank you. The next question, how will Measure S change the quality of life in rural areas in Nevada County?
Oh, I don't know. I'm a professional in rural health areas, but the issue is, in my mind, it clarifies some issues for patients, and the quality of life of those patients obviously would be improved if they're able to access their medication without lengthy drives to Sacramento or without dealing with loss of product for a variety of reasons, whether it be through missing out on some of the innuendos left in 2349, which many of my patients have suffered from. They get a visit, and the next thing you know, all of their medicine is gone. And they put not only blood, sweat, and tear equity into it, but they put their own capital into generating that medicine. It would be, in my mind, that if we were to have Measure S, there would be less questions that I would get from the patients because it would be clearly stated or enunciated in the law. Patients would be able to comply without the fear of being encroached on by law enforcement. So in my mind, those folks who are growing under Measure S would do so in a lot friendlier environment. So that's my opinion.
Thank you. Next question, why is the growth and regulation of low THC marijuana not part of this measure or issue discussion?
That's up to the patient, and their doctor to decide what direction they need to go in as far as cannabinoid ratios and concentrations and milligram amounts. This world of cannabinoid medicine is evolving very quickly, and just like the individual patient, those recommendations are pretty individualized depending on what malady or disease state they're dealing with. But ultimately, at the end of the day, many of my patients are growing high CBD and I would say lower THC cannabis. However, a lot of data is now showing that we have an entourage effect between many of the cannabinoids, and so therefore there's going to be a lot of hybridization of plants that may have mixes that would have varied ratios depending on what that patient's needs are.
And I'd like to point out that CBD is a wonderful byproduct of cannabis that is fairly new discovery. But THC is very important too. If you're fighting cancer, THC is essential. There's room for both plants, and I don't think it's incumbent on any regulation to determine which ones you can grow. It depends on your needs.
The next question, what are the biggest differences between the current ordinance and Measure S, and why are those significant?
I would say the biggest difference is moving away from square foot restrictions to plant counts. Technically, we could have exactly the same amount of plants grown on a property. We just give people elbow room to grow healthy plants. Under the county ordinance, they want you to squish it all into this little small parameter that doesn't allow for air circulation, that fosters mold and fungus, and it ruins the medicine. I don't understand why the amount of room is more important than the number of plants, and we seek to fix that with Measure S.
Thank you. What changes have been made to the county ordinance since it was first passed as an emergency measure?
The only change was one that was required by the Superior Court when suit had been brought to challenge the ordinance, and Judge Edwards determined on motions in the early stages of the case that the way the ordinance had actually been passed, it effectively prohibited collective cultivation, which was specifically allowed by state law. So after the court's ruling, the county adopted a minor language change for that. Otherwise, it's been exactly the same.
But they did not give us any extra room to accommodate those collectives either. It was all words, not actions.
Okay. If Measure S is passed, could this encourage even more drug-related crimes in Nevada County?
No.
I agree.
Again, this measure has nothing to do with drug abuse or criminal drug sales or any kind of state law violations. What the ordinance has as its focus and its purpose is to provide some reasonable regulation of people's use of their own property to cultivate marijuana for their medical needs and those of the people that they associate with. And there's absolutely no evidence that there's any connection between these lawful activities and the criminal cases, which the sheriff wants to focus on and try to suggest is really what all of this ordinance is about.
And then my last question, could the growth and distribution of medicinal marijuana come from somewhere other than Nevada County?
Well, it could, but we're here. We need medicine here. We have no dispensaries. We have no distribution system to speak of, and it's all up to each individual grower to provide the medicine they need.
One of the provisions in Proposition 215 in 1996, so we're getting on close to 20 years ago now, one of the purposes of the Compassionate Use Act, as stated, is to encourage the federal and state governments to implement a plan to provide for the safe and affordable distribution of marijuana to all patients in medical need. Well, the safest and most affordable means is for people to grow their own.
Thank you. Now, as I mentioned, those were the questions that honestly I edited because I wanted to make sure both sides could have an answer. So I picked questions I felt were open enough for both sides to provide an answer. But I had an individual question, and Patricia said I could ask anything I wanted.
Absolutely.
So I do have one question that would be specific to this group, just as I had one that was specific to the other group. But someone asked me, how much and by whom does Patricia Smith, leader of the Americans for Safe Access, Nevada County, gets paid, and does she reside in Nevada County?
I wish I got
So
paid.
how much and by whom?
I have not received a dime for any of the work I do for Americans for Safe Access. This is truly work from my heart, and it's something that it's purely voluntary. Every person that works for for Safe Access is a volunteer. Nobody gets paid. And yes, I do live in Nevada County.
Thank you. Well, thank you. I appreciate you all humoring me, allowing me to ask those questions. And again, I think it really helps us provide kind of some fair coverage, asking multiple viewpoints the same question, and we'll be able to share those answers. So I think Carrie needs to sneak out of here. If you see her leaving, it's nothing personal. It's not that she doesn't like me. But now I wanted to make sure we provided an opportunity to ask questions individually, and that's why we're all here. So if you have a question, I saw this hand up first. Would you like to come over and speak into the microphone? I think there's a microphone right in front of you there too, if you like. Never mind. That's Paul's microphone. He doesn't share.
I don't really have a question. I kind of have a statement. My throat is bad from the smoke.
Could you state your name too?
My name is Song Cowbell, and I'm a 37-year resident of Nevada County.
Thank you.
One of the things that I have found, I'm a patient. It's a little disturbing to have to defend my right for my medicine. I don't see anybody on OxyContin or anybody who's on antidepressants having to ask the government to regulate it, nor do they have to have a lock on it and to keep it away from children. So I want to say that first, and then I want to say that one of the things that have happened is they've kind of created their own problem with taking away our plant count and putting it into small areas and then having to fence it. One of the things that have happened is that you're getting, as you said, you're getting mold, you're getting, the mites happen, there's all these things that happen because there's not good airflow. And then what happens with that is people have to start using things on their medicine to get rid of those things, and then we've created another problem. And I think that Measure S really, really needs to pass for the patients. I personally can't drive very long. I have Lyme disease, I have very bad hands, I have bad feet. And so if it doesn't pass, we're in trouble for a couple of reasons. One, we need some common sense here, and that's why Yes on S needs to pass. We just need some common sense back into our government. And I think that for those of you who are wondering if this is something that should pass, I'm a patient, and I'm not dangerous too much to anybody but myself. And please respect the fact that those of us who are patients and that we stand up here and we have to publicly acknowledge that we have illnesses, please respect that. There aren't many other people who are going to come up and say, hi, I'm on antidepressants, or hi, I'm on pain meds, or whatever. The other thing is, I heard on the radio the other day that in 10 states that have passed the medical marijuana thing, that the deaths from overdosing on things like other pain medications have dramatically dropped. And I think that's really important, so I just wanted to mention that.
Well, you should be up here on the panel.
I'm on the panel. I'm just down here.
You're just down here. Do you have a question?
No.
Okay.
Thank you, though, for
thank
everything
you.
you're doing.
Thank you.
And I think there should be an ordinance against forest fires, which have totally trashed our air.
All right. Second row there. So please state your name and ask your question.
Okay, my name is Yvonne Watcher, and actually I would like you folks, because, and especially maybe Patty and maybe Doctor, to talk about how the CBD plants actually take more space and more, so if we're going to go for a more CBD, a higher CBD, which honestly, I'm in the healing field, I believe that THC and CBD are both important for healing. And I've had experience in that in another state where it's fully legal. But I would like you to explain that a little bit more, how we need more space for actually growing the high CBD plants, because I know this for a fact to be true.
Well, the CBD plants that we've been watching, they're small. I mean, the THC plants are the ones that Sheriff Royal calls the giant sequoias, which I'm still waiting to see one in person. But the CBD plants can be only 3 or 4 feet tall, and it takes more room to produce the same amount of medicine. And it is such a powerful medicine that is helping so many people. It's what's stopping catastrophic seizures in children. It is working wonders for PTSD. And we need this medicine, and we need room to grow it.
Hello, my name's Alex Beeson. I guess this question's more directed to Stephen. Do these abatement cases, do they have an actual value that they profit on it, or is it just, does it have a value, the case? Because I know each abatement case has a certain case number.
Right? What do you mean by value?
Like, is there any money that is produced out of the abatement for them?
No.
No.
But it would appear from the way that the process is run by the Sheriff's Department that what they get from it is eradicating plants. As I mentioned, they treat the appeal hearing not as an effort to get people into compliance with the ordinance, but as a way to get a decision that their plants have to be removed or abated. So if you want to weigh the value to the Sheriff's Department, it's that they can get a lot more plants removed by this form of enforcement than they can by arresting people that they think they might be able to prove are violating the law. So they can go to people who are clearly trying to comply with the law, with state law, and then get rid of their plants, and that's a lot less manpower required than to go out and find an illegal garden and take those people to court and come in and testify and all the other stuff they have to do for a real legal case.
Are you aware of them at all receiving like grants from the federal government to eradicate, or?
No, there's long-standing federal grants for various kinds of drug enforcement, and Nevada County gets a small amount, less than the salary of one officer, that's directed towards marijuana efforts, I think. But so that's just part of the way that the national law enforcement network works.
Cool. Thank you.
Thank you. Any other questions?
Hi, my name is Bobby West. One of my questions is, once this law passes, Proposition S, is there any chance that we get a testing facility here so we can test the CBDs and all that stuff, so we can truly prove that it is medical and good for us? You know. There's
no reason we couldn't have one now if there's a big enough need. Most of the testing facilities are in Sacramento, and they're doing a pretty robust business from growers here in Nevada County.
Yeah, I noticed that. So it'd be nice if we had something here, because there's certain types of medication, higher CBDs, or something that I need for my body that I'd like to know what I'm smoking that has it in it and make sure it does. And so if we have a facility here, we can show people this is exactly what is in this flower.
Yeah,
this
one
medication.
fight at a time.
Yeah.
Let's get the cultivation first, then we'll worry about the testing facilities and distribution after that.
Thank you.
What does it take to bring testing to Nevada County?
Money?
Well, specifically, how much?
I understand the equipment's quite expensive, but you know, it's like any business, so you're not going to get a Trader Joe's here because we don't have a big enough population to support their business. So if we have enough people that are actually doing this, and hopefully with Measure S, we will get many more growers that are following the medical cannabis route, that it'll make it worthwhile for somebody to open a shop here.
Other question?
Hi, my name is Jonathan Waldman. I'm a Nevada County business owner. First of all, I think we need a dispensary before we have a testing facility.
They kind of go hand in hand.
First, I have a question and then a comment. I'd like to know what you think the potential of what might happen on the legal front if Measure S does not pass.
Well, I mentioned earlier that there was a lawsuit challenging 2349 right after the county passed that, and that suit was dropped about a year later because of the state Supreme Court decision in City of Riverside versus Inland Empire Patients Collective. And in that decision, the Supreme Court acknowledged both Proposition 215 and SB 420, and that they had in their statement of purpose the intention for medical cannabis to be widely available and inexpensive. But they also said that the state constitution grants the powers to regulate land use and similar matters to the cities and counties, and that nothing in either Prop 215 or the current statute under SB 420 limited those powers. So what that creates is a legal avenue for cities and counties to ban cultivation and ban dispensaries and ban whatever aspects of medical marijuana law they want to regulate locally until the state law catches up with that decision.
And unfortunately, the growing trend in counties is to come out with total cultivation bans, including hefty fines if you're caught growing. Like in Fresno, there's a $1,000 a plant fine and a 10% per month interest charge. And if you cannot make those payments, they will take your property. We don't want to see that happen in Nevada County, and I don't understand why we can't find a way to work for patients and homeowners. I mean, many counties and other states have been able to accomplish this, and I don't understand why we're so incompetent that we can't find that happy balance that takes care of patient needs and homeowners as well.
Yeah, I think it's kind of a widespread information that's coming from people that are having ordinance checks, that the officers checking them are telling them that there is a ban that they're working on if Measure S does not pass. And as a business owner here in Nevada County, I would also like to bring into the conversation something that can be bipartisan. It has nothing to do if you support cannabis, if you use cannabis. It's the undeniable fact of the fiscal impact on this county of having cannabis, medical cannabis here. It is state law that you are allowed to sell to dispensaries and make a profit off of that, small profit off of that. So my business recently joined a new coalition called the Nevada County Merchants Coalition in support of Measure S, and it's bringing together businesses to support Measure S in the sense of what would happen in our county if all of this money left the county, if all these people left the county. Where would those property taxes go? Where would the sales tax go? Where would all taxes go? And how many more of our local stores are we waiting to watch close until that time happens?
Thank you.
Thank you.
Hi, I'm Laura Rose McLeod. I have a question probably for Steve.
I'd like to know what the estimate of cost this county has spent on the ordinance that's in place.
Well, there'd probably be a way to figure that out or get an estimate of it, but I haven't done the homework. You'd have to look at the budget of the Sheriff's Department and figure out a portion of the narcotics task force salaries and support and all that sort of stuff. But they've got, I'd say on average, they have about 2 full-time officers, almost full-time officers, devoted to the ordinance enforcement stuff, which is, as I mentioned earlier, is probably less manpower than they used to spend on trying to make arrests for criminal violations. So, you know, how do you figure out? Yes, they're devoting some resources to that now, but they've taken resources away from trying to find people violating the criminal law, so they balanced it out.
So if Measure S passes, do you see the cost of the Sheriff Department's costs going down?
No, but I see them being able to focus their same staff on the criminal growers instead of on people who are trying to comply with the law.
Would that be nice? Thank you.
Thank you.
Hi, my name is Al Owens. I'd like the panel to kind of conjecture on a kind of a long-term, big-picture question, which is, in just a few years, it's probably going to be the fact that marijuana and cannabis cultivation is legal in California, both medically and recreationally. So why would Nevada County want to disadvantage ourselves with a complete ban when we could have a reasonable ordinance so that individuals could grow legally and there wouldn't be a sort of a Wild West kind of a situation when cannabis actually becomes legal in California, which is probably inevitable?
Do you want to take that? Well, I do believe that by 2016 that marijuana will be legalized for recreational use in California. What that will look like is anybody's guess at this point, because I've seen about 500 different variations of initiatives that have been floating around, and they run the gamut. My hope and belief is that once it is legalized, counties will come on board, but if you look at Colorado for an example, there's very few actual counties and cities where you can buy recreational marijuana in Colorado. The vast part of the state is dry, and that could certainly happen here as well. And the ones that have come on board are not experiencing the sky is falling problems that have been conjectured would happen if it passed. And there's definitely ways to regulate this and make it work for everybody, and it's law enforcement that has stood in the way of any meaningful regulations passing in this state for the last freaking 20 years. Every single time they have put something forward, it has been law enforcement that has put the kibosh on anything moving out of Sacramento. And if we could work together, we could make this benefit the entire state. The tax base could be enormous, and the tourism in Colorado has gone through the roof. You can't get a hotel room. There's just so many benefits that can come from this, and I don't understand why we want to stay in the dark ages here, but it seems to be the way we're going.
Yeah. But in the immediate present, what we can do to make sure there isn't a ban in Nevada County is to pass Measure S.
Yeah, yes. Because, I mean, just one final idea is that it seems that our county would be wise to position ourselves to take advantage of all the obvious benefits of not being a dry, quote, dry county in California, so that because we're already positioned in terms of a climate, in terms of there are people that already grow, and so that all these numerous benefits could be taken advantage of by the county if we had a sensible ordinance in place. Thank you.
Thank you.
Thank you. Any other questions? I think everybody has a question. We're going to be here a while.
Hello, I'd like to thank you for being here. I'm Mike Pasner. This ordinance was passed by the Board of Supervisors, and I think mostly written by Keith Royal, and it was in an emergency fashion. Why was this an emergency? I don't get that at all. Thank you.
Do you want to take that?
Well, I think that's really a rhetorical question, but it was an emergency because the sheriff saw an opportunity to try and eradicate more marijuana, is the way it looks to me.
His supposition was that if we didn't pass one immediately, that growers from all other counties would flock into Nevada County because our rules were more lax than theirs. Now our rules are much stricter than all of our surrounding counties, and it's all based on fear. That's what everything comes down to. It's what if, what if, what if. And we don't even have to speculate anymore. We have concrete examples of what does happen when they regulate this in a sensible fashion, and it can work for the benefit of all of us.
Any other questions? You got a question or a statement?
Kind of both. Two things.
Thanks for your honesty.
So the first thing is, there's been a lot of complaints among residents that the police are jumping over their fence, that there's complaints and none of the neighbors would be complaining, and it's a complaint-driven ordinance. Yet, it's impossible for somebody to have complained, yet they're showing up saying that there was a complaint. What can people do when that happens?
Well, first, it's a misconception that it's a complaint-driven ordinance. Mm-hmm. In the process of trying to gather support to get the ordinance passed, the sheriff referenced the fact that he had these hundreds of citizen complaints about odors primarily, but problems with growing. He was never able to document a single complaint. Law enforcement, because it tends to operate on a basis of confidentiality or secret investigations, which is contrary to the rest of our government, which is, we have open government laws and public records laws, so things have to be open. Law enforcement investigations are exempt from that, so the law enforcement people are used to handling things confidentially and keeping things quiet and privileged and so forth. But there doesn't need to be a complaint, and there doesn't need to be anything on a property that's actually a nuisance in the sense that it's bothering somebody. What happens is that 2349 defines certain things that you have to comply with. And if you're out of the compliance with those definitions, that's defined as a nuisance. So if your fence isn't strong enough, that's a nuisance. If someone can see the top of a plant over your fence, that's a nuisance. It doesn't have to be complaint driven. It doesn't have to actually bother anybody. And really, in the way that they're going about it, the sheriff's department is not paying any attention to whether there's a complaint or not. Sometimes they run a whole neighborhood. And
that's what they're doing in many places, yeah.
Although I'd like to say at the Board of Supervisor meeting when Sheriff Royal was selling this an ordinance to the supervisors, he stated emphatically that this would be complaint-driven only.
And that's where I get that
and
from.
It had very quickly morphed into any reason, any excuse. If they see it, they could come after it.
That was actually a good question then.
Yeah, thank you.
Any others?
Hello, everybody. My name is Stephen Brightsky. I've lived in Nevada County my entire life. I'm 21 years old. Also, just a quick background. One of the reasons I'm interested in this, about 3 years ago, I ended up going to Highland Springs Medical Center, as a matter of fact, for back pain that I have had ever since I was 16 years old that I have from an injury doing sports. And cannabis was actually one of the few things that actually helped my back in a way where I could still function and do tasks around the house, but have the pain deadened enough that I could function without any kind of threat of a negative side effect like addiction, overdose, anything like that. I could really just use what I needed to and then go on. Anyway, though, it's pretty obvious everyone here is a pretty big supporter of Measure S. It looks like everyone here is in favor of it. But the question that I have is does Measure S to you look like exactly where we need to be? Does it look like where we want the laws to be, or does it just look like a compromise that get us headed in the direction we want to be headed?
I'd say it's a little of both. I would like to see it more lenient, to tell you the truth, but we had to weigh the needs of everybody, not just patients, and we tried to come up with the most reasonable compromise we could that would serve everyone.
Okay. I've kind of got a second question. This one's more directed towards Mr. Munkilt. You were explaining how the police handle a lot of the marijuana complaints here. They basically just show up, confiscate the plant matter, and then it is destroyed. Do you believe that that is excessive, number one? For two, do you think we can expect to see the same things happen under Measure F? Is there a violation that they won't be looking at it as getting compliance, but they'll be looking at it as, snatch and grab opportunity to get marijuana away from people?
The county would have to go quite a ways to try to enforce Measure S the same way that they're doing under 2349. 2349 it sort of expressly authorizes the sheriff to be the enforcement arm. And again, going back to my initial comments, the sheriff should never be involved in land use issues. And Measure S leaves that completely out of the picture. What we would anticipate is that most likely the county would find an alternative method for seeking to get compliance with Measure S compared to what they're doing under 2349.
All right, thank you very much for your time.
Thank you. And I got that same shirt, by the way. Punisher rules.
Oh yeah, big fan of the Punisher.
Do you have a question, ma'am?
Hi, my name is Susan Pelican. I just would like you to please talk about the other arbitrary rules under the current ordinance in terms of growth, besides square foot versus number of plants. What are the other things that make it really difficult for people to be able to grow the best crop that they can, which is what a farmer or a grower would want to do?
Well, the thing that always jumps out to me as what I believe is a completely unconstitutional aspect of 2349 is the requirement of posting a landlord's notarized statement that they are supporting this federal crime. That places the landlord specifically in a position of having made an incriminating statement. There's absolutely no excuse for that kind of stuff, except where the whole measure is trying to have a criminalization of what should be a land use issue. So that's the most egregious thing and most clearly illegal thing about 2349 is these requirements for landlords, but also for posting private medical information in a place where it's open to view. That's also, I think, a violation of our individual citizens' rights as outlined in Article 1, Section 1 of the state constitution.
I think one of the most outrageous things in the county ordinance is the requirement that you cannot grow on a slanted hillside, that every garden has to be level in hill country. And to me, that makes the other 27 pages of their regulation meaningless because right out the gate, you cannot comply.
You know, my biggest concern always has been square footage, because that's the biggest complaint I get from my patients. I have patients that come in and say to me, "Hey doc, I got my 99 plants in," and I'm like, "Whoa, you got 99 plants in? Well, what allows you to do that?" "Oh, 100 square feet, man. Don't you understand? 100 square feet. I got one little footprint that's 1 by 1. And so when they deal with that issue, and unfortunately patients have been misguided to think that that was okay, because the clear intent of the law was to look at the canopy when it was fully mature at the 100 square feet, which is just really uninhabitable for any plant. And even the worst gardeners out there would never set up a garden like this. I mean, the blackest of thumbs wouldn't even organize their plants this way. So it's my concern primarily that these plants get spaced out. There's good gardening practices and safer uses of the land area. So.
And another point with the square footage is they're not even enforcing it the way it was intended. Every square foot requirement that I've ever seen in any other county only measures the actual canopy of the plants, not the area in between. Our county is different. Every square inch from one edge of the garden to the other is included in the square footage. It's just a silly way to regulate plants that grow, and you never know exactly how big they're going to be. I mean, they can be from 3 foot to 12 feet. You don't really know until the end of harvest.
And what about the indoor-outdoor requirement? That is exclusively indoor or exclusively outdoor?
That's what the county regulation has, and we wanted to get rid of that primarily. Most people don't grow both simultaneously, but during the summertime they grow outside. During the wintertime they may grow indoors. But people need to keep their stock, their mother plants, and that requires some indoor growing during the summer season. And to say you can't do both at the same time says you cannot keep these stocks that are so difficult, some of them, especially the CBDs, to come by. And also in the county regulation, you can only grow in one little area indoors. You cannot divide it into a flowering and a vegetative room, so you cannot keep mother stock going. It was never written to facilitate growing or patients' needs. It was written in the most punitive manner possible to make it as difficult as possible to produce your medicine.
Thank you. Anybody else have a question before we do a second round with the... Do you have a question, sir? Yeah, come on up.
Hi, my name's Vincent Butt, and this was a question for the doctor. What I had was, do you find it better for you to be able to prescribe to your patients the medical marijuana for their drowsiness and all that, rather than a prescription painkiller or something that's going to eat up their stomach and make their butt bleed or whatever it does, you know, like they show on TV nowadays?
Sure.
So I just was wondering if that...
It is actually harder to do a medical recommendation than it is to do a prescription. And the reason why that is because number one, there's extra scrutiny placed on the clinician. Number two, there's extra scrutiny placed on the patient. And it's actually, it falls into a gray area as far as the state's concerned, but ultimately as far as the feds are concerned, I have a First Amendment right to make these recommendations, and then the government gives me by proxy through the DEA the ability to write prescriptions, which are completely and separately different. But the problem is a lot of people that come to me are naive to cannabis, and their goal is to be introduced to it in such a way that's sort of safe and effective. And many patients who are naive to cannabis, they march into the 2014, grow cycle, and the next thing you know, they're sitting on their butt and they don't know what hit them. So you got to be real careful with what you recommend and how you recommend its use.
Correct.
So,
okay.
Thanks.
Thank you.
Thank you. Paul Emery, KVMR.
This is a question for Mr. Munkelt. Can you explain the difference between a code search warrant and a criminal search warrant, and the level of proof that is needed in each of those in order to enter somebody's property?
Well, the term search warrant really applies to criminal investigations. When you're doing an administrative act like an ordinance enforcement, there's a potential for getting an administrative warrant. That could be an inspection warrant, would one way to describe it or refer to it generally. And what I have seen in this county along those lines for our ordinance is situations where a person has appealed the abatement notice that was given under the ordinance, and then the decision of the appeal was to uphold the abatement notice. And then on some occasions, not all, but on some occasions, the sheriff's officers have gone to the court to get an authorization, an inspection warrant to go in to the property to abate the area that was found in violation. It would take way too long to explain why there are many problems with the way that process is carried out. The shortest statement I can make about it is this process is leaving way too much to the discretion of the officer in the field to make decisions on what they take and don't take, things of that nature.
Would it be kosher for me to ask a question?
Sure.
I want to know why all of a sudden the sheriff's department is taking the position that search warrants are no longer necessary. Oftentimes people ask for them and they're not produced, sometimes for weeks or even a month later. When did that become okay?
Well, my opinion is it's not okay, but the problem is that for law enforcement to be forced to agree that it's not okay, you have to take them to a court and have a judge tell them it's not okay. And the opportunities to do that are few and far between. So when practices develop in a particular law enforcement agency or community that may not be fully recognizing the rights of the citizens that they're dealing with, or may not be good practices that could be addressed by the court, there still has to be a situation which brings that to the court, and it has to be litigated and get a decision to get it straightened out.
Just when you think the battle's over.
So the practical advice is, if you're confronted with a law enforcement officer who generally has a gun on his hip and a taser on the other hip or something like that, and you're ordered to do something, the best thing is to be as compliant as you can without completely surrendering your human rights.
But if you let them in without a search warrant, have you given up your rights?
No. What often happens in this county when they have a search warrant, they want to rush in, and this is part of the sort of militarization of law enforcement that's part of the process that the war on drugs has encouraged. When we have prohibition as the policy, and officers can write their warrants to explain to the judge that, when people have drugs, they also have guns, and when people have guns, they shoot at us, and all that sort of stuff. And so they develop a practice where it's routine for them to go in on a SWAT team basis to people's homes where there's absolutely no reason to believe that any kind of violence is going to erupt. And so people who are just going about their daily lives and suddenly confronted with the SWAT team approach, with people coming in with guns drawn, bulletproof vests on, yelling at, get down, sit, go. The full command routine that they use, people are frozen and don't know how to respond, and often that's taken as a sign of resistance in the mode that the law enforcement officers are operating in. It's part of the mindset. And so they have to overcome the resistance in order to protect what they perceive as their safety. And these are complicated issues. There are times when that's what they have to do. So it's not like there's no basis at all for using those tactics. What happens is they become routine tactics and impact ordinary citizens not involved in ongoing criminal activity or drug cartels.
Now, my job as a moderator to pull this back to questions related to Measure S. Sorry.
Which
my
is
apologies.
land use, not criminal, yeah.
Exactly. There's one way in the back before I want to make sure we give everybody a chance to at least ask a question.
Boy, I want to ask you one.
Uh-oh.
Why isn't aren't the abatement actions in the police blotter in the union?
That was one of my questions that I received, and maybe it was your question. But I didn't feel like the panel here could answer that, so I was only picking questions I thought both sides could answer. But I have all of these questions, and that's one of them that I intend to ask our law enforcement as well. I don't know how folks here feel about our police blotter, but I would say half of the people I talk to really enjoy reading it, feel informed. The other half say that we should not publish it at all. So I'm not sure how to provide what everybody wants. But it's a very valid question. How come they're not in there? And I intend to find out. Any other questions? We have two right here.
I have a question about the current ordinance, and also about Measure S. So in the current ordinance, I've read it pretty thoroughly, and it said that criminal charges could never be applied to people that are out of compliance nuisancely. But I've seen in the paper someone that had a nuisance or compliance check that apparently was reported, but then they also have criminal charges being applied to them. It seems contradictory to the nuisance ordinance. My second question is, how can the Measure S stop criminal charges against patients? Is there any provision stopping that from happening, basically? So that's my questions.
Well, let's start with the first one.
Measure S does not have any enforcement measures included in it, and we did that intentionally because we felt that was something best left to law enforcement to deal with. All we're interested in doing is creating a safe framework so we aren't necessary involvement with law enforcement on this. If we follow the provisions of Measure S, there will be no interaction needed with law enforcement, and they will be freed up to go after the people that are really causing the problems in this county, the ones that are polluting our environment, selling out of state, or dealing in other criminal activities. I think that is a better and higher use of law enforcement resources.
Thank you. And then there was a second question.
I don't remember what the second question was.
If the nuisance ordinance isn't supposed to be applied to any criminal charges, why do we hear things in the police blotter where it says compliance check, yet there's criminal charges being applied?
Well, I would say that that goes back to my initial comments about when you have law enforcement trying to enforce a land use ordinance, you're going to have an adversarial relationship to the citizens instead of a cooperative relationship with the citizens. So when the sheriff goes in and says, gee, this looks like you got a few too many plants, we're going to call this a criminal case, and sit there on your porch while we go get a search warrant so we can take all your plants out and start prosecuting you. Or they can come in and say, hey, looks like you're not doing anything criminal, but you're out of compliance with the ordinance, so we're going to say you're out of compliance with the ordinance, and we don't want to take your plants for that reason, but at least you don't have to go to jail. It's the adversarial relationship and the criminalization of what should be a land use issue that arises out of, I mean, this is their training, and this is their approach, and that's what they do.
Thank you. Good question. Do we have any other questions?
I got a real quick question. It's just on the dog issue that we've had with law enforcement. Now, you were a case, Stephen Munkelt, where Ferrari sued the Department of Justice for $14 million for killing a Rottweiler at the Hells Angels Clubhouse in San Jose. In the last time they came, there was a dog present. There was no animal patrol present. I do believe there was a case law with the Supreme Court of the State of California that when a dog is present, they issue a warrant. They must have animal patrol present, which they clearly did not do on us, and an officer law is required by law, no law, disobey the law, so he's criminally negligent. How do we file a Department of Justice complaint, a lawsuit, and sue these guys like they've done 20 times in Humboldt County and teach them that they are civilly and criminally liable?
Well, I think keeping it focused on Measure S, which unfortunately is limited to Nevada County and not Humboldt, the key issue here is Measure S will promote a cooperative means of getting people into good neighborly compliance with their cultivation of medical marijuana. And that's a very valuable contribution to our community life, and in contrast to the adversarial and hostile relationship with the community that is fostered by 2349.
Thanks for being patient.
No worries. So this is in regards to a general audience that is viewing Measure S. I would really like Patty and Doctor to talk about how you address the children within the medical marijuana so that people can understand that, because this is something that's going out to the public, and people are thinking, this is how I'm hearing back, that we're encouraging children to smoke marijuana, and this is not the case. So if you would please address that in regards to the medical marijuana measure.
Sure. Well, concerning this measure, obviously it's about a safe and affordable access for patients under guidelines that are clear and concise so they can be followed easily, even if you're an adult with the mind of a child. So my take on recommendations to children is a serious one. I think a lot of information has come out in the last 6 years regarding recommendations to children, including infants. I do have a small patient population which includes those who are under 18, and we treat those very closely, and it's reflective of their individual needs. You know, Sanjay Gupta, after I think 2 years ago, came out with a big turn on his opinion on medicinal cannabis, specifically around Dravet syndrome, and cited some cases in Colorado which featured the Stanley brothers and a young girl named Charlotte. And what happened there was you have a small population of children with this disorder who suffer, you know, hundreds of seizures a day, ultimately disabling them and leading to permanent brain damage. They were able to shut these seizures down using high CBD cannabis oil, you know, 90–95% of the time. Now we're seeing across the board more families treating their children with this for a variety of things. Kids with autism, kids with ADHD, kids with chronic anxiety or chronic headaches, even visual problems, and even in chronic pain. There's children who have had multiple burns or traumas or surgeries for a variety of reasons who are benefiting from using cannabis and avoiding some of the side effects of prescription medications. All I can say is that if you remain ignorant to the implications and the power of this medicine, shame on you, because ultimately you have to empower yourself to take advantage of the information that's out there. And I always recommend to my patients Google Scholar, PubMed, enter CBD, enter THC, enter any malady you want, and you can read a paper about it. So educate yourself and know that giving this to kids is not only safe and effective, but also a better direction to go than giving them prescription meds in many cases.
I would like to add that in this country, we give children Ritalin and Adderall by the boatload, which is nothing more than methamphetamine in a pretty box.
You're totally right. It's good stuff.
And also, cannabis is no longer just a smoking material or a medium. It's available in so many different forms now. There's tinctures, there's ointments, there's salves, there's edibles, there's juicing of the raw leaves. There's so many different delivery systems available, and we encourage those more than we do smoking, although there are some instances where smoking is the most efficient and best use of cannabis, especially, and this seems counterintuitive, but if you're having an asthma attack, it will stop the attack in seconds, where one of those inhalers can take minutes. So it's just very valuable and has so many different purposes and applications that should all be taken into consideration when you undertake this type of therapy for children or adults.
And of course, Measure S has nothing to say about recreational use, and that's really what a lot of people are concerned about with young people. And so let me just mention the one issue on that in the measure is that state law prohibits marijuana-related dispensaries and similar activities from taking place within 600 feet of schools and other places where children congregate. The current county ordinance has a much wider field. It includes many other places, additional places where there may be children or might be children, including all the bus stops, whether they're used or not, for school. And it also widens the range to 1,000 feet. So what Measure S would do with that specific thing is adopt the state standards, which our state legislature said are perfectly adequate to protect young people from exposure at places they normally congregate. And of course, then most of our supervision of young people is left up to parents, so that's as it should be.
And also, I'd like to add that the original county ordinance that they submitted to the supervisors had the same 600-foot setback that we're asking for in Measure S. And it was us, Americans for Safe Access, that volunteered to increase those setbacks to 1,000 feet in exchange for them removing these antiquated bus stops that haven't been active in decades. And they agreed to that. They took the 1,000-foot increase in the setbacks, but they never upheld their end of the bargain by removing the school bus stops that aren't active.
Maybe I'd ask if there's any final questions. I wanted to make sure I left a few minutes. I'd like to give each of the panelists a chance to have some closing statements. Since we've been asking them questions, we haven't really given them an opportunity to kind of speak up on their thoughts and viewpoints. So maybe last question.
Hello, my name is Kane Graham. I was just wondering if you could comment on whether you thought the quantitative guidelines allowed patients to grow enough biodiversity to treat themselves and to have enough stock.
I'm sorry, I didn't quite catch that.
The quantitative guidelines, 6 plants per patient, I believe.
Mm.
Do you believe that allows us enough biodiversity to grow different, we'll call them strains, to address different maladies or different uses?
It is the absolute bare minimum, and we went with the lowest standard just because of the controversy in this county. We hope that by joining collectives that we can kind of mix and match and get all of our needs met. You know, like one grower might specialize in the CBDs and another might specialize in a certain strain of THC. And it is difficult to get all your needs met with only 6 plants, but I think if we work together, we can find a solution.
Great, thank you.
Yeah, just one quick comment. You bring up a really good point because a lot of my patients suffer from a variety of illnesses and issues, and so a lot of them will ask me, well, what should I have in the ground? And a lot of times there's good resources, whether it be WikiLeaf or Leafly, and you can go to these places and learn what these different plants do or what they're known for. And a lot of times patients who don't have green thumbs and who don't have phenomenal gardening skills end up with a very low output as far as a harvest goes, and they run out of medicine quite quickly. So if I have my druthers, there would be a pretty high ceiling on what people could grow and have access to. And so I'm encouraging patients to access a lot of the leftover material, including bigger leaves and trim that come off of other populated grows, and get those donated to them, or they will acquire them for low cost, especially my cancer patients who are juicing plant material. So I think no matter what we do, it is going to be restrictive, and we can't just have, you know, people growing 1,000 plants on their property, but ultimately I think this is a safe and friendly middle ground where people can kind of get most of their needs met most of the time.
Thank you. Any last really good questions before I turn it over to some final statements? Why don't we start on this end? Steve, do you want to go first?
Sure. Measure S is an important improvement for Nevada County's management of medical marijuana cultivation, and it focuses, as it should, on good neighborly land use in the county. It focuses cultivation primarily on the properties that are not zoned as purely residential and limits the potential impact of smells and other kinds of nuisance values, if we use that word in the general sense rather than as defined by the current ordinance. Yuba County passed a marijuana ordinance at just about the same time that Nevada County did. And it originally had almost exactly the same terms and language and enforcement approach. But the sheriff there and the Board of Supervisors engaged in a cooperative negotiation with the local marijuana cultivation community, the medical community. And they modified voluntarily their ordinance to have a plant count limit similar to what Measure S proposes for this county. And they modified their enforcement so that the compliance officers generally, when they find a problem with compliance of the ordinance, they encourage the landowner or occupant to come into compliance before they cite them for a violation. Measure S is intended to promote that kind of cooperative enforcement of land use standards in Nevada County, and at the same time would prevent the supervisors from considering an entirely complete ban on cultivation in the county.
Yeah, I think the reason we're here tonight is to really discuss what would be the impact on our community if Measure S were to pass. And for most people, the answer is nothing. The vast majority of our population live in areas where outdoor cultivation will not be allowed. So nothing changes for them at all. They have the same protections under Measure S that they would have under the county ordinance. And my question then is, where are these patients supposed to get their medicine if they're not allowed to grow their own? And the answer is collectives. Measure S takes cultivation from residential neighborhoods and moves it to the larger ag parcels, and they put a tight cap on how many patients can be in any collective. And it's not a huge number. It starts at 3 patients on 5 acres and increases to 10 patients on 30 acres. And this is how people are going to get their medicine in the future. There's a lot of marijuana that is being grown in this county, but there's not a lot of medical marijuana, and not all marijuana is medical. It has to be grown organically, and then it has to be lab tested for purity and potency so that the end user knows exactly what they're getting. And there are plenty of laws on the books already that deal with these people that are breaking the laws, like I mentioned before, the ones that are polluting our forest, stealing electricity, diverting water. Those things are already illegal. We didn't need the county ordinance to codify that. The whole point of Measure S is to make sure that patients have safe and reliable access to their medicine. And I'm just curious, if it was your child that was suffering with hundreds of seizures a week, or if it was your wife that was going through the rigors of chemotherapy, or if it was your son that was battling the demons of PTSD, would you still not want them to have access to this medicine? I think you would. And I hope that we've answered most of your questions here tonight, but if you should have unresolved issues around this, please go to our website at www.asa-nc.com, and it has comparisons of the county initiative versus Measure S. It has the full text of both of them. It has the ballot arguments, and I hope that that will help you make an informed decision come November 4th.
Dr. Devlin?
Yeah, one quick comment. I just want to say thank you guys so much for coming out here for a good hour and a half, 2 hours, and spending time with us. In my mind, it was very easy when Patty invited me to say yes to come here, because I think as an advocate for my patients, and I think any good clinician out there would agree, that in order for these folks to have less fear and less paranoia around the medicine they're trying to generate legally on their own property needs to be clearly outlined, and I think we're taking a big step forward with Measure S. So by voting for Measure S in November, I think we'll be helping the medical cannabis community in this area evolve in the way it should. Thank you so much.
And I'd also like to thank Jim Hemming and Paul Emery for all their hard work trying to put this together. It was no easy feat, let me tell you.
You're welcome. And I'd like to echo Dr. Devlin over there. Thank you for coming. Thank you to the crowd here at the Nevada Theater. Thank you for all the folks watching on NCTV. So I hope this helps provide information about Measure S and helps you vote building up to November 4th. So thank you again for coming, and have a good evening.
You're watching NCTV, celebrating 20 years of community broadcasting.